Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about drugs, medications, and other kinds of things like that. And joining me is Eric Rolen. He is a substance abuse counselor with Palmer Continuum Care. Welcome to the program, Eric.
Good morning.
Now, you've been here several times, but for people that may not have watched a show, tell us a little bit about Palmer Continuum of Care. What kind of services do you offer? How do you access those services?
Sure. Palmer Continuum of Care is an adolescent outpatient program for substance abuse counseling. We serve ages 12 to 18, and we provide 3 levels of treatment and can refer to an inpatient setting if that's necessary.
Okay.
They can access our services by contacting us and setting up an appointment for an assessment, or we have walk-in clinics from 9 to noon on Tuesdays and Thursdays.
Now, can they get a referral through their own physician as well? Is that another way to access you?
Absolutely, absolutely. If you take your child to the doctor and he has some concerns and there's a disclosure of substance abuse, simply call our number, speak with our administrative assistant. She'll do a quick screening over the phone to make sure you're appropriate for our assessment, and then simply just show up on Tuesday or Thursday, bring the child and their social security number, and that's really all we need. And that assessment and screening is free.
Okay. Now, in terms of, you talked about the free screening, what about if a person needs counseling or some other services that you offer? Do they have to really be worried about, do I have enough money to pay for that, or how do you work with individuals?
That's a great question. We do not deny services to anybody. So if there is a financial need that needs to be met, we'll work with that family, even if that means providing services at no charge. We're not going to turn away anybody.
Okay, excellent. Now, let's look a little bit at our subject here.
Sure.
So let's start with the big umbrella.
Okay.
Prescription, non-prescriptive kinds of drug abuse phenomena.
Right.
Is that a growing thing in youth, or is it something that we're starting to see, or you're starting to see some decline?
Absolutely not. This is exploding, not just in Oklahoma, but across the United States. Been several reports on world news programs about the increasing dangers of prescription drug abuse. And within the last month, Palmer had, actually suffered a loss of a consumer that had been doing well, was overly confident, and had obtained some prescription drugs and ended up overdosing. So it's really playing Russian roulette with your health.
Okay, now we're going to get into some specifics of those kinds of medications and drugs. But let me ask, in terms of what you've seen in the clientele that have come in for assistance, what sort of motivates or causes youth to seek sort of drugs, in terms of, is it because of we think of low self-esteem?
Right.
Is it because they're trying to fit in with their peers and they're with a group that unfortunately are taking that path? Exactly what kinds of things are motivating them or causing them to continue in this path?
Well, that's a very complicated question. But what we do know are that there are some protective factors that can be put into that child's life early on.
Okay.
High parental involvement in extracurricular activities, in a good support network, in management of their mental health and their physical health. And that is up to about age 14. At age 14, the main influence of an adolescent turns from inside the home to outside the home. And they start to go through a process of sorting out their values and determining whether they want to accept the family values or replace those with values of their own. So they start to experiment in different areas of life, not just with substance abuse. And so substance abuse happens to be one of those areas that they start to experiment with. Now, if those protective factors haven't been put into that child's life, they're at a higher risk for continued substance abuse.
And as a result, the peers may be more of an influence than maybe the family structure and what you've been trying to sort of impart to them.
Absolutely, absolutely. The relationship between the parent and child is paramount in preventing substance abuse. At age 14, our words start to have less of an effect on our child, and our relationship is really the motivating factor in them you know, following the rules and achieving things and really wanting to please and honor their parents.
Now let me ask this, how young should we start talking to our children about substances and things such as that? Because sometimes we think, well, they're just elementary school age,
Right.
they're not into that kind of thing, and we can wait.
Right.
But how young should we, and then how do we approach it?
Right.
Because sometimes we don't do it because we don't know how to approach it.
Absolutely. You know, the question I think a parent needs to ask themselves is, if I'm not talking to them about it, who is? And if you look at the media, if you look at some of the information out there that gets absorbed by kids as young as 4 and 5 and 6 years old,
Okay.
it paints a pretty good picture of alcohol use. I mean, there's alcohol use in multiple cartoons that are out there. Dumbo, for instance, there's a famous scene in that Disney movie where he drinks the bucket containing alcohol, and he wakes up on top of the pole and he can suddenly fly. So here's Dumbo, who is a misfit, gets picked on, he consumes alcohol, and he discovers a new talent and becomes the hero of the movie.
And he can do magical things, and
Absolutely.
kids that young looking at that are wanting to do magical things too.
Right. They start to internalize that experience with that substance is a pleasant experience that's going to produce pleasant results in their life. So if we're not counteracting that as parents and presenting a realistic picture of substance abuse, then that leaves the door open for them to form their own values in that area.
You know, and that's very true. And you think about even commercials that can
Right.
be in between even what appears to be a healthy cartoon, because you
Right.
do have to screen cartoons.
Absolutely.
And you see people drinking and they're having fun.
Right.
Well, the child is associating fun with drinking, not the absence of the drinking having fun. It's the opposite.
Right. And you'll see a lot of alcohol commercials, strictly beer commercials, where they show people having fun and exercising on the beach, and then they're consuming alcohol. And as adults, we know that those two things really don't go together. You can't really exercise when you're consuming alcohol. But as young children, they don't put those two things together. They see the smile on their faces, they see that they're having a good time, and they link that with alcohol consumption.
Okay, so you're telling us as young as 4 or 5 years of age, we need to be talking to our children, looking at what they're looking at, and not assuming it's an innocent, totally innocent kind of
Correct.
cartoon even.
Correct.
Now, what about as the child is getting older? I mean, how often should we engage in this? Because we don't want to be where the child is like, oh, here they come again.
Right.
And they shut down, they're not listening to us,
Right.
like, but they've heard nothing.
Right.
So is this something we should visit every couple of years, or as we get into our discussion of drugs, as we're seeing signs, but that's kind of too late. We don't want to
Right.
do it when we see the signs
Right.
before. How often should we kind of check in?
You know, there's no schedule for that, but if you're involved in your child's life, you're going to be able to notice if there's some abnormalities, if there's a change in friends, if there's a change in appearance or attitude. And I would recommend at least twice a year sitting down with your child and covering some information about substance abuse. You know, reading over information together on the internet. And you do that together as a family so that it doesn't look like you're singling somebody out and that you're judging somebody.
Good idea, because especially as the child gets older and hits those teenage years, they're very sensitive to not
Right.
wanting to be singled out, or you're
Right.
talking about me, why me?
Right.
So you want to make it as natural and just a casual kind of conversation.
Right. Absolutely.
Okay, take a quick break and then come back and get into some specifics of these drugs. Please stay with us. We'll be right back.